So first, let's dissect the question in detail. What is the difference between psychiatric illness and a character flaw? Quite a straightforward question. It's just asking you to explain the difference, but what is less straightforward is exactly what they mean by psychiatric illness and character flaw. So let's dig into that a little bit more. It's a really, really important point with the John Locke essay competition to be very, very precise and specific with your definitions and how you define your terms in the question, because whoever's marking your exam is not going to be persuaded or impressed by your argument if it's unclear what exactly you are talking about if you haven't defined your terms. So the keywords here obviously being psychiatric illness and character flaw. Let's see how we might define those. Psychiatric illness, I'm going to read this one out because it's quite wordy. A psychiatric disorder is a mental illness diagnosed by a mental health professional that greatly disturbs your thinking, moods, behaviour, and increases your risk of disability, pain, death, or loss of freedom. And that is from the DSM-5, which is a diagnostic manual. So it's sort of the main manual used to diagnose psychiatric illnesses or psychiatric disorders. And underneath that, you can see here, I've underlined a few of the key features of a psychiatric illness. So often they link to behavioural patterns. They have to cause distress in the individual or individuals, and they can't be a sole result of social deviance or conflicts with society. And they must have clinical utility, which means, it can be diagnosed, diagnosis leads to treatment, etc. So I hope that makes sense. That is one definition. Definitions do vary, but I think this is a really good one to work with since the DSM is so universally agreed upon as an effective diagnostic manual. So here are some examples. And I'm sure you might have heard of a lot of these examples already. Things like depression, anxiety, anorexia is one of the most common eating disorders, bipolar and psychosis. I've listed a few others here that you might not have heard of, so addictive behaviours, schizophrenia, which is essentially another word for psychosis, and then we've got personality disorders. And you'll notice that the blue ones all have different subtypes, so there's multiple types of personality disorders, which we'll get into in future lessons. There are many, many psychiatric disorders, it's definitely worth saying, so bear that in mind when we're looking at the question. Now on to symptoms. So again, I've listed out some of the most common symptoms that occur across the broad range of psychiatric illnesses or disorders.